1:30, and welcome to the Behavioral Health Provider Listening Session. My name is Jennifer Peterson, and I'll be your cruise director today as we go through these slides. I'm new to some of you, so welcome for being here. Just a quick disclaimer from my side of the house. This meeting is being recorded today, so please make sure that you're careful with the things that you share. And not disclose anything that you wouldn't want to go into public disclosure request. Other than that, this space is definitely yours to hear from us, and we're here to listen to you guys. We're grateful that you're here and taking the time today. And with that, I will turn it to Miss Teresa Claycamp. Has Teresa joined us?
Don't believe she's here yet, but I'll start us off. Just wait one more second for her to see if she joins. Thank you for your patience.
Oh, yeah. For the outside world, us DBHR folks start our meetings at on the 5s, and so sometimes we're on the whole number. We're like, oh, we still have time. So definitely a lot of grace for Miss Teresa.
Well, good afternoon, everybody. I don't know if
she is. Hi.
Hi. Looks like we've got 104 folks so far. That's fantastic. Well, good afternoon. My name is Teresa Claycamp, and I'm the Deputy Director here within DBHR, one of the Deputy Directors, and Deputy Director of Treatment and Recovery Programs, and I'm here to welcome you all to start off with. Before we get going, first of all, just thank you for attending today. I know it's a short week for many of you. I hope you are have good plans to spend time with friends and family and to be reflecting on things to be grateful for. Couple housekeeping items. Just want to remind the group that if you're not speaking, to please remember that you're muted. This call is being recorded, and the recording will be available on the contractor and provider resource page in approximately 1 week. And because the call is being recorded, it is open to public disclosure. Today we will hear from various sections of our sections here within DBHR, and we'll also have some time for some Q&A. We're also going to talk today about 6628 legislation, particularly something related to that legislation that was passed last year, and then also a brief update on our decision packages and priorities for legislation. I'm going to pass it over to my colleague Enos for additional introductions, and thank you for your time.
Thank you, Teresa. Good afternoon, all. Name's Enos Bacha. I'm one of the other deputy directors within DBHR. And before we get to the section updates, just wanted to acknowledge that we are currently living through some challenging and unclear times. Our agency continues to focus on the values that drive our work, practice balance, patience, checking reality against what we see in the media, and always thinking about what the best next step would be. I want to encourage you all on this call to reach out to DBHR leadership or others with questions, support, or asks for help. We're all in this together. I will now welcome Sonia Pipek, who will give us an update on our substance use and prevention and mental health promotion section. Sonia?
Thanks, Enos. Good afternoon, everyone. Sonia Pipek here. I'm a supervisor in the prevention section. We wanted to share with everyone today on the call that we do have a prevention funding opportunity, which will be announced shortly here in the coming weeks. You can learn more at athenaforum.org. We have a space there for all our future funding opportunities that are posted. It isn't posted yet, but should be soon. So if you're interested in learning more, you may follow that link. The other thing I wanted to share today is our section hosted a really successful event, our annual Prevention Summit, downtown Seattle this year, October 30th and 31st. It was well attended. We had about 564 people in attendance, with 428 of those being adults, 121 youth, which was a great youth turnout, and 15 sponsors and exhibitors that were there. We have our annual Prevention Professional Awards of Excellence. We were able to provide 13 awards to individuals across the state that are doing fabulous prevention work. We were also really lucky to have the Seattle Seahawks mascot Blitz that made an appearance and helped with those awards. We also were blessed with having the opportunity of Captain Christopher Jones, who's the director of CSAP, who came and joined us, did a presentation, and spoke about the national prevention efforts and how CSAP, their current initiatives, can support states and communities doing the great prevention work across the nation. Summit content also ranged from like state data sets and all the way to helping our coalitions in their communities engage and do that prevention work. And so far, early in-person feedback indicates that attendees really enjoyed the summit content and appreciated the intentional programming and presentations that were provided. So that is what is happening in prevention.
Thank you, Sonia. I would now like to introduce Diana Cockrell to give us an update on our prenatal to 25 behavioral health work. Double check to make sure Diana is with us.
Yeah, I think she might be having a hard time connecting.
Okay.
So I don't know if you want to.
We can come back.
Yeah.
Yeah, we can come back.
You.
Yeah, we'll come back to this update. I now want to pass it on to Shelly Shore to give our recovery support services update.
Hi there, I'm here for Mo Bailey, our section manager. Wanted to provide some updates about the new 80-hour curriculum for certified peer specialist training that we're going to launch in March 2025. We have another pilot coming up next week for the training. We have a new FAQ, frequently asked question page that we're happy to share with everyone. Thank you to our communication team that helped us writing this and creating this paper. We are also having some new supervision trainings for supervisors of certified peer specialist trainees. We have piloted both the trainers and the pilots for the trainings themselves, and we will provide new trainings for supervisors starting January 1st, 2025. I recommend everyone to check out the Department of Health webpage about peer services and the new peer profession. They just completed the next draft of the ethical guidelines for peer supports, and you are welcome to check it out. I can put that address in the chat in a moment. We also wanted to update that HCA partnered with Rutgers Department of Psychiatric Rehabilitation and Counseling Professions to present a 4-part training series, and there are 2 sessions left in the series. Session 3 on December 2nd at 9 a.m. on motivational interviewing, and session 4 on January 16th about stages of change. And there are links to register for anyone that would like to have this opportunity. I'm here for questions, and I'll put the webpage in the chat as promised. Thank you.
Thank you, Shelley. Diana, were you able to get your audio to work? Okay, she still must be working on it. Now I want to pass it on to Alex Stoker, who's going to give our adult and involuntary services update.
Morning, everyone. I'm here on behalf of Car Panic. I'm Alex Stoker, the Adult Services Supervisor. We have a couple of updates from our section this month. The Problem Gambling Program has launched a new youth problem gambling prevention collaboration with the prevention section. Our crisis team has launched a mobile crisis response endorsement program webpage, which providers can access additional resources and program-specific information. The link is there in front of you and will be provided with the slides after today. Finally, the Involuntary Treatment and Crisis System section staff provided 3 webinars to about 420 members of the Adult Family Home Council of Washington about changes to the behavioral health crisis system, least restrictive alternatives to acute crises to help intervene with help sooner, how to navigate the system in acute situations. And there's actually one additional that I'm not sure if it got added to the deck, that we have had a new PACT team added in the Thurston Mason area. Unless there's another slide, I believe that is my update.
Yep, that is it. Thank you, Alex.
Thanks.
Diana, I saw you pop on camera, so hopefully you're all situated now. Yeah, if you're speaking, we still can't hear you. Sorry about the technical difficulties. Going to pass it back to Shelly Shore to give our update on diversion and reentry.
Anos, that's actually me. This is Nicole Mims.
Oh, hi, Nicole.
Hi, thank you. I'm also experiencing some glitches with my internet, so just making sure that you all can hear me.
Yes, we can hear you just fine.
Okay, awesome. Very cool. So again, I'm Nicole Mims. Thanks for all the thumbs up. I am a section manager here overseeing diversion and reentry. Our team, one of the teams within our section is working on what is called the Civil Discharge Agreement. This is an agreement between the Healthcare Authority and DSHS, as well as Disability Rights Washington. And the overarching goal is really to improve discharge plans and outcomes for people exiting our 2 state hospitals. And so the state met another performance measure this as the transition and discharge planning system went live at both Eastern State Hospital and Western State Hospital this month. We also submitted our second biennial report for 2024 under this civil discharge agreement, and we will meet with Disability Rights Washington in December to go over that report. Our HARPS providers have requested additional housing voucher dollars earlier this fiscal year, which has been earlier than usual, suggesting an increase in housing voucher utilization across our state in fiscal year 25 in at least 2 regions. And our True Blood team, which is the other team within our section, in phase 3, which is the Thurston Mason region and Salish region, we recently released a RFP or a NOFO, Notice of Funding Opportunity, for an additional 16 crisis stabilization beds in the Thurston Mason region. So that RFP or NOFO is currently out now, and I believe it closes the end of December. Thank you.
Thank you. I'm going to now pass it on to Tony Walton for our adult substance use and treatment update.
Yeah, hey, good afternoon, everyone. My name is Tony Walton. I'm a section manager within the Division of Behavioral Health and Recovery, and happy to be here today and providing some current resources, some funding, and an upcoming webinar. And so I'll just kind of briefly summarize each of these. The first bullet point refers to some funding that Washington State Healthcare Authority received during the 2024 supplemental budget, specific around long-acting injectable buprenorphine. And so you'll get these slides and there's a link there, but please do check out the link if you're a smaller organization that's looking to incorporate this as part of your Medications for Opioid Use Disorder program. It helps you get set up with the reimbursement and funding for the initial dose of the long-acting injectable buprenorphine. And so a great opportunity to help kind of get additional medication out into the community. The second is a resource that was recently released from ASAM, the American Society of Addiction Medicine, around engagement and retention of non-abstinent patients in SUD treatment. And so kind of looking at ways in which to engage with somebody who, for whatever reason, hasn't been able to reduce or stop their use to the point where it might be impacting their ongoing engagement with the treatment curriculum and their individualized service plan. And so a newer resource from ASAM, and ASAM is available to kind of answer questions and provide support on that. But very relevant in terms of how we are moving towards ASAM 4th edition in Washington State. And I think this guidance really aligns with a lot that we are finding within the 4th edition. Finally, finishing up with an upcoming webinar, because those are always fun to attend, especially when we're learning about recent results of our statewide drug checking network. And so just as a reminder, in case you're unfamiliar, we do have, or CEDAR, University of Washington ADAI, receives funding to implement drug checking networks across the state in several different syringe service programs. So this is an opportunity to review some of the results of that drug checking and have a really current reflection or representation as to what we are currently seeing in Washington State's drug supply. You know, is xylazine really increasing? Are we seeing more of that within the fentanyl? And is fentanyl still showing itself within methamphetamine and other substances? And so really crucial as we're supporting individuals who are using drugs to have a sense of what they might either be anticipating to have in their drug supply or what's not anticipated, and how that's impacting our overdose rates, as well as the treatment that's being prescribed. And so that is happening on December 11th at 11 a.m. And you can even ask questions ahead of time, which I thought was a nice addition. So if you have any kind of burning questions around drug supply and what's in the current pharmacological makeup of the drugs that people are purchasing off the illicit market, you can include that question when you register. So I think that's it for the updates. And
thank you, Tony. Okay, going back to the prenatal to 25 behavioral health updates, we wanted to make sure that you all had an opportunity to join this webinar hosted by the Office of homeless youth in partnership with HCA and DCYF. For information on the secondary prevention, specifically homeless prevention for youth and young adults, the focus of which is to prevent deeper system involvement and out-of-home placement. So it sounds like that's going to be a pretty good webinar. The group will be sharing 4 recommendations that will fall along the early and late secondary stages of prevention continuum from the state's strategic plan for homeless youth prevention. And the link in the slides for more information and great efforts of all the work that's happening. Also, as always, want to make sure that you're all aware of the Washington Prenatal to 25 behavioral health efforts happening. So all those links will take you to all of that great information. Thank you. That's now concludes our updates, and I want to pass it back to Tony to introduce our next presentation.
Yeah, thanks so much, Enos. And Stephanie, I saw the note in there for the registration link. I think that's referring to the upcoming drug checking network. And so I think we can, I have it ready and I'll paste that in 1 second. But before that, I wanted to introduce some colleagues from UW-ADAI, so very relative to some of the upcoming webinars that are here to talk about shared decision making, which came out of 6228. And so Senate Bill 6228 was a substantial piece of legislation that was passed during the 2024 legislative session. It included a number of things, some things that Department of Health is implementing, like a model policy for discharges or involuntary discharges from residential treatment. It involved direction to the Washington State Healthcare Authority and Office of Insurance Commissioner to implement and decide upon ASAM 4th edition. And so a lot of different elements coming out of that one piece of legislation. But what we're here today to talk about, and Amy Lee is going to go into this a little more detail, is shared decision making around medications for alcohol use disorder. I think the bill tried to identify and acknowledge the fact that over the past couple of decades, we've seen a 2 times increase in alcohol-related deaths across the United States. And so additional focus on the fact that alcohol use disorder is still impacting individuals' lives, and that there was an increased, emphasis on expansion of resources and availability of medications to treat alcohol use disorder. And so Amy, if you're here, I only see some of the pictures up at the top. So hoping
I'm
Amy's
here.
here. Oh, wonderful.
Yes,
Awesome.
yes.
Well, thank you so much, and others from UW-ADAI for being here. And I will pass it off to you to talk about some of the efforts you're doing to support that work.
Great. Thanks so much for that intro, Tony. So I'm here today with Anthony Floyd. We are both at ADAI, or the Addictions, Drug, and Alcohol Institute from UW. So if we could advance the slide. Great. So I wanted to give you an overview of 6228 as it's written into law, and then also just kind of discuss more concretely what our work looks like. I think sometimes translating what's in the law to what's actually happening in real life takes a little bit of work. So we wanted to give you some context here. So in 6228, Section 3, the section really outlines what our ADAI here at UW is tasked to do. So we are here to help create a patient shared decision-making tool to assist behavioral health and medical providers when discussing medication treatment options for patients with alcohol use disorder. And then to distribute this tool along with a previously created tool for opioid use disorder to behavioral health and medical providers, and help them incorporate the tools into their practices, and then also to conduct regular evaluations of the tools and update the tools as needed. Next. Great, thank you. This slide really outlines what the law means to people who are working in licensed or certified behavioral health agencies. So what the requirements of the law say is that licensed or certified behavioral health agencies will need to provide education related to pharmacological treatment options to patients seeking treatment for opioid or alcohol use disorder. that the education needs to include an explanation of all the recognized forms of treatment approved by the FDA that are clinically appropriate for that patient. And then providers may choose to use a shared decision-making tools that ADAI has created. However, if folks already have their own tools that they're using, they can continue to use the tools that they have. So they don't have to use the tools that we create, but we're creating one in case it is helpful for different agencies that may not already be using something. And then the last part of that we have outlined here says that if the patient chooses a clinically appropriate treatment, medication treatment, the behavioral health agency will need to support the patient with either accessing that treatment directly or a warm handoff for referral. And then this part really talks about how, like, basically, it indicates the requirements on how BHAs will advertise and treat for alcohol use disorder and opioid use disorder, which the DOH will be leading on this. Section D mentions that this does not apply to hospitals. And overall, just want to say that ADAI has been in communication with the DOH and the HCA on how this will all be defined. We're still really early on in the stages, but I'm here today just so folks kind of know that this is coming and that we will be helping to communicate these changes as we go along as part of our implementation package as well. Next slide. Great, thank you. So I just went over the bill. So now I want to really highlight what our team's goals are here at UW. And the first one is to really just involve clients, clinicians, and staff who are working in these behavioral health agencies throughout the process to understand everyone's needs when having shared decision-making conversations for alcohol and opioid use disorders. And we really want to design tools and provide support that's simple, streamlined, and really supportive of client, clinician, and staff needs. And ultimately, our goal is to really contribute to the work that all of you are doing as behavioral health agencies to provide the life-changing and life-saving treatments in a client-centered way. Next slide. So there are 3 ways for you to get involved now. So the first way is that we are having one-on-one conversations with agency leadership so that we can really learn more about operational and clinical challenges and opportunities with this law and learn how we can best support your organization. If you are working in a behavioral health agency and you're interested in doing focus groups or interviews with us, feel free to reach out to me directly. I have my contact information in the slides. But we're conducting these focus groups and interviews so that we can really hear directly about folks who are on the ground working with clients, what your needs are, what's helpful, what you're already doing, and things that also wouldn't be helpful. And we're also interviewing clients so that we can understand their perspectives as well in shared decision making. And for people who will participate in focus groups or interviews with us, we will compensate your time with a small thank you gift card as well. All right, so this next slide just kind of shows you some of the tools that we've developed here at ADAI. So this one is our medications for opioid use disorders tools. It used a really similar process of talking to agency leadership, focus groups, and interviews to develop this handout. Some of you might be familiar with this. To date, we've distributed over 10,000 of these handouts and trained to them as part of the state opioid response over the last few years. Next slide. And this is just the other side of that handout. And then if folks don't already know, we have this website, Learn About Treatment, that folks can access some more tools related to opioid use disorders. So just showing some examples of what we've done in the past related to this. And next slide. All right, I think that's the end. If you are interested or have questions, please don't hesitate to contact me, Amy KZ Lee at uw.edu. And I think Anthony is on the call, so wondering if he has anything else to add.
No, I think you did a wonderful job, and I just want to reiterate that it's really valuable to have people involved with these conversations, these focus groups, to help to get a diversity of views, because we know that there are many different kinds of programs, and they implement the work can be very differently, and just sort of having a nice diversity of perspectives helps us to put together better tools.
Thanks, Anthony. And thanks for your time, everyone.
Thanks, Amy. I am going to turn it back over to Teresa. Or I'm happy to introduce Kim Wright, who's going to walk us through the behavioral health priorities.
Actually, I'm on.
Oh,
Sorry.
there she is.
Sometimes I lose my cursor when I have three screens going.
Right?
And you're just looking for that cursor. You're like, you'd really like to find it. So my apologies. Thank you.
No, not at all.
Yes. So I would like to introduce Kimberly Wright, who is our Behavioral Health Operations and Planning Supervisor, who will be going over some of our decision packages and priorities for the next biennium. First of all, I want to thank ADI for a great presentation. I really appreciate that. Before we kind of dive into community behavioral health priorities and decision packages, I do want to just caveat and just, speak transparently that I'm sure folks are hearing that the budget this year is going to be challenging. We do have some significant budget challenges in our state. So, we will be presenting our budget requests and priorities here that DBHR did submit, but with the understanding that there's no guarantees, right, that the funding will be available for these requests, given the current budget constraints and climate that we're in. That said, wanted to present what we have submitted as our request. So I'll go ahead and pass it over to Kimberly Wright.
Thanks, Teresa. That was a great introduction, and thanks for framing kind of the budget outlook this year. Nice to meet all of you. For those that don't know me, Teresa's introduced me, but I am Kimberly Wright, and I have the pleasure of being here at DBHR in operations and being the operations supervisor. So again, I'm going to review kind of our community behavioral health priorities. I'll say for maybe the third or fourth time that these are only requests. We remain hopeful about the budget outlook, but these are just requests at this time. So we'll go ahead and go to the next slide. And then the one after that. Thanks so much. So a little bit of background. I'll do kind of some background framing on each of these and then what our ask is. In 2007, Washington's legislature passed the Marty Smith Law, and that law established certain provisions to ensure safety for behavioral health staff. So HCA has put forward a request to collaboratively develop an updated, inclusive, and accessible violence prevention training curriculum with DSHS, community behavioral health service providers, and employee organizations who represent community behavioral health workers. This is to ensure adequate safety of all staff who are working in a variety of settings, while expanding the training's reach and offering some remote training opportunities. Next slide. So CCBHCs, there's been some significant legislative interest in the adoption of the model of certified community behavioral health centers, or CCBHC. And HCA has put forward a request for support of ongoing work to establish certified community behavioral health centers as Washington State's intervention model. So current funding is expiring for that on June 30th, and this is work to establish and implement these centers. HCA has also put forward a request to continue and expand funding for programs established by the Blake Bill, or 5536. This includes collegiate recovery supports, health engagement hubs, implementation and evaluation support, medication for opioid use disorder in jail program support while transitioning that program to the Medicaid waiver, a WISIP, that's our Public Policy Institute study of the Recovery Navigator program, or the RNP, outcomes and effectiveness reporting for trainings, implementation of diversion data integration platforms, and development of a statewide behavioral health treatment and recovery support services mapping tool. That's a mouthful. A little bit about PATH. So PATH outreach services are designed to meet immediate needs of people experiencing serious mental illness or co-occurring disorders. And HCA has requested supplemental funding to support current PATH programs with wage enhancements and program operations. This is what we hope is this will create competitive wage offers and promote supervisory sustainability. Increasing wages would hopefully bolster PATH services and the program's ability to engage with eligible individuals while increasing consistency of supervision. In 2000, the Reentry Community Services Program, or RCSP, was implemented to improve public safety and provide mental health treatment for individuals who are exiting Department of Corrections facility who had that history of sickness and past violent crimes. HCA put forward a request to continue and expand the RCSP ability to provide wraparound supports. Ultimately, this funding would allow us continued and increased stability for participants by increasing access to care at higher levels of service and stable housing. Our new Journeys for First Episode Psychosis program is coordinated specialty care treatment curated to meet the needs of those experiencing a first episode of psychosis with treatment services of a higher intensity than those that would be offered in regular outpatient settings. Treatment provides evidence-based behavioral health and recovery support interventions for youth and young adults with first diagnosed psychosis. And we're asking to continue and expand support for the evidence-based treatment for New Journeys and that outreach and intervention for youth and young adults. So HCA is requesting funding to stabilize community and school substance use disorder prevention and mental health promotion services offered through Community Prevention and Wellness Initiative, or you might know it as CPWI, and to increase the ability to detect behavioral health trends in youth and young adults through the Healthy Youth Survey and the Young Adult Health Survey. Ultimately, this would allow the program to disseminate data in accessible formats and empower the generation of local solutions for local issues. So a little bit of background on this is for FCS, or our Foundational Community Supports Program. It was approved for the 5-year renewal on June 30th under the 1115, or Washington's Medicaid Transformation Project waiver. HCA is seeking an increase in expenditure authority for this program, the FCS program, to account for significant growth in foundational community support enrollments and demand for services, and to align the FCS reimbursement rates according to our rate study recommendations. And then ASAM, there's quite a bit of background on ASAM, but in 2020, HCA and the Office of the Insurance Commissioner were directed to adopt a single standard of criteria to define medical necessity for substance use disorder treatment and levels of care in Washington. ASAM, or the American Society of Addiction Medicine criteria, was selected as the single standard following an independent review of rules and practice. And so this request is to support implementation of those ASAM-4 criteria and transition to the updated criteria. It's also to begin preparation for the adolescent and transition age adults version, or ATE. That's kind of a fun acronym that will be released in 2026. Our CLIP Children's Long-Term Inpatient Program is seeking to address kind of the current CLIP system needs and additional staff to absorb the increased workload and provide improved family supports for CLIP families. This is to ensure experienced professional staff are able to be retained and recruited to support increasing capacity and specialized expertise to meet treatment needs for youth and families statewide. And then True Blood Phase 4, we in partnership with Department of Social and Health Services are committed to prioritizing the successful implementation of agreements that are finalized or any agreements that are finalized as part of the True Blood Phase 4 negotiations. We expect that these negotiations, which are currently in process, will be finalized this fall. So DBHR has been directed by the legislature to respond to quite a bit of increased behavioral health need and manage high risk, high profile, and complex projects and programs. Each of those requires sufficient staffing to succeed. We've put forward a request to make permanent some existing FTEs that were provided to us on a project basis while we implemented certain things, and identified areas that require additional support to achieve successful implementation. And finally, our last request is that we were tasked with creating a bulk purchasing and distribution program for naloxone. HCA conducted research on program designs and convened some stakeholders to solicit feedback. We received a big response from BHAs that showed a need for upfront funding to purchase initial stock before they could restock and replenish a model for naloxone. So in an attempt to navigate this, we're seeking support for behavioral health agencies to buy supplies of naloxone and for small clinics to buy long-acting injectable buprenorphine to support expanded access for statewide opioid overdose reversal medications and treatments for opioid use disorder. And then I'm happy to take any questions. I saw the chat kind of blowing up a little bit, but wasn't able to engage with it as I was kind of reading my slides. So if anybody wants to come off mute and ask any questions, happy to answer what I can, or others on the call answer any that they can.
Thank you, Kim. And just to add to that, appreciate all those updates, Kim. And now it is time for questions. So like Kim mentioned, if you have any questions on the presentation that you just saw or anything else that was shared this afternoon, please feel free to either raise your hand or put your question in the chat. Let's see, I know somebody has their hand up. Cougar Courage. Did I see that right? Courage Change. I apologize.
Cougar Courage, all right. I'll take it. Hi.
My apologies.
Very appropriate. I was giggling before I did that. So I have a question. I'm just as a clarification. HCA Washington State's goal to put the adult ASAM 4 into action is still January 1 of 2026, correct? I got confused with the youth slide.
Yeah. No, that's confusing. Thanks. I could probably answer this, Teresa.
Okay, thank you.
Yes. So the legislation actually sets our timeline. So 6228 legislation that was passed last year requires both the Office of the Insurance Commissioner and Healthcare Authority to implement the ASAM 4 by January of 2026. So we're on target for that at this point. And then the adolescent and youth version, the ETA version, is not actually officially released yet. So we anticipate that one to be released in early 2026 will be released. So we don't have an implementation date yet for that version because we need to see when it's released and then kind of develop a plan from there. So
perfect. I'm working on it, but I just wanted to clarify that date again. Thank you so much.
Good, you bet. No problem. And then there's another question in chat for the ASAM 4 trainings. We actually have trainings offered ongoing, and we started that already this year. Let me grab the link for everybody. And those are free trainings to folks. So I'm going to just grab the link and I'll do that in just a second.
Hi, Teresa. This is Amy Durr. I just wanted to chime in and let everyone know on the call that we're going to be updating the link and the trainings with some upcoming trainings in the new year as well. So just so you know that this is kind of trainings that might happen between now and the end of the year, but more are coming.
Thank you, Amy.
And Amy, we would be messaging out through the Gov delivery here shortly, right? Like when we update those dates, we'll update when those are occurring. So that should be happening here soon. And then I'm also grabbing the ASAM webpage for folks to grab too.
Yeah, that's correct. It'll go through there, and I'm sure we've been sort of addressing ASAM and the trainings at a little bit at each provider call. So remember to just give that update at the next one as well.
Thanks, Amy. Any other questions?
Yeah, I think I just posted an old one. Gosh darn it. Never mind. I'm trying to look for the most up-to-date FAQ to Amy, and I don't have that. So,
Teresa, I can work on it right now.
okay.
All right. Oh, thanks, Kelly.
Thanks.
There's a question from Duncan in the chat. Any prediction on what will happen with Medicaid funding when healthcare reform from the federal level?
I think that's a really valid concern. I think we're all watching that as well. I think folks are well aware that we are a expanded Medicaid state. We have a lot of wonderful Medicaid benefits in our state. Both some are required and some are optional. And so we're really lucky and fortunate, and there could be changes at the federal level that could impact us. And so I think we're all kind of in a wait and see mode, and certainly that's a valid question.
Thank you for that. Any other questions?
No, these are helpful. Happy Thanksgiving, you guys. This is Angie at the Cougar Agency. I love.
I'm never gonna live that down now, huh?
I'm gonna keep that.
Happy accident.
Yes.
I hope we get all of our money that you put out for.
I actually have a question for Kimberly Wright. Kimberly, as far as the budget goes, right? So we've submitted, we've submitted our requests, all the things. When would we expect to see a budget from the governor?
Yeah, I think that's a great question, especially this year. So we'll see budgets from governors, and that's kind of unique to this year, something that I haven't experienced. So we are expecting to see a budget from the seated governor, Governor Inslee, in mid-December, and then we should see one from the governor-elect Ferguson. And I would be completely speculating on that timing, so I won't speculate.
That is different this year. That's a really good point. So normally we look for the one budget from the governor, right? But this year we're going to see that, and then we're going to wait for the second governor-elect budget. So that is new for us, as for many of us, right? So that will be new for us. So that's something that we're going to be seeing shortly.
We will learn and experience and learn about that together, and certainly share with all of you as we learn about that ourselves.
Any other questions? Double check the chat.
We're all caught up in the chat.
Okay, thank you. Thank you, Jen. Just want to give a little bit of space just in case anybody had some difficulties getting off mute, or if anybody's currently typing.
Oh, there you go. Is there progress towards an EMR from the state level? I'm hoping that you guys know what EMR stands for.
Electronic medical record.
There you go. Thank you.
I don't know
Not
how
that-
much we can
Oh.
publicly share, but I was in a meeting recently about the EMR efforts at the state level. My understanding is that we have made a bid, or we have received a bid from Epic, and it's under review. So we're looking into that further.
Thank you, Alex. Good question.
I always find that the search option for our website is down when I really need it. So I know there's a website or a webpage on our website. It used to be EHR as a service. I don't know if that's what it's called anymore. But I know we have a landing page that provides updates and I can't get to it.
Right. Any last minute questions?
Do we have a call in December? Sandra or Jennifer?
No, there's none scheduled for December.
Okay, so our next time together will be January.
In January, yes.
Okay, great.
Okay.
See you
So
in the new year, I guess.
Absolutely.
Sorry, it looks like there's a question for the contractor provider page on the HCA website, and I wasn't able to find it. I don't know if anyone else knows that page where the recordings go. Jen, do you have that?
I can put it in the chat.
I don't know if people outside of HCA can see the chat after the meeting, so we probably just want to add that
Gotcha.
before the meeting's over.
I can do that.
Thank you for remembering that question. Okay.
Yeah, and I know Sandra had put a link in earlier, and that does have like the August slides as well as how to sign up, but it doesn't have the recording, so that's
Yeah, and I'll have to do some checking on that.
So anything that we're not able to locate during this meeting, especially for those outside of HCA that won't be able to see the chat, we can email that out, so that everybody that was here will have access to that.
Exactly.
Okay, so since I'm not seeing any additional questions in the chat and no hands raised. Oh, new message. Okay, no hands raised. Teresa, any last minute thoughts?
no, just happy holidays and see you in the new year, and thanks for being here today.
Likewise. Thank you all for being with us. Really appreciate your time. And to second what Teresa said, enjoy your holidays and we will see you in the new year. Goodbye, all.
Thanks, Behavioral Health Peeps, for helping me.
Anytime, Jen.
Have a good holiday, guys.
Thanks. Bye-bye.